we help? How can coaches help? One of the thought is the social workers. We may not be able to directly help these people because we need psychiatric help. And I remember speaking to Dr. Suchandra when I said that, I was talking to someone and I realized that she needs treatment. After some time, I realized I will not be able to coach. She's a patient of counseling or psychiatric. So she said, at least if you don't give them the medicine, why will they listen? So I know I have worked with people who have a complete team. They have a doctor, they have a counselor, they have a coach. So there are leaders, very senior leaders who actually have this entire team to support them. However, where we can help is possibly the social workers in the NGO sector. They are dealing with a lot of stress of their own, I'm sure. Dealing with such patients. If we can just ask any questions, any thoughts that is coming in from anyone we want to share.
In this presentation, my question is there any overlapping part between psychological counseling and coaching? Because we are talking about people who are left out from the society.
Yes, there is. I have one of them working in my home. Usually nobody would hire them. We had to make a breakthrough because people will say these people still take medicines. They still are part of a psychologically ill unit. Normally they would not be taken. Now she's working with me for 2 years. Now why do I say coaching? Because they also have self-respect. They should also have the will to work, to fund herself, go forward. She loves her money, she doesn't want to spend her money. So we counsel her on what to spend on your money. The only thing that would inspire her is probably a piece of gold jewelry. So not even clothes, not even how to live better. One of the challenges is how should they live better? Because within their limited means, can they live better? So there is lot of therapy. If you go and talk to them, they feel valued. Your time is also precious to them because nobody wants to talk to them. Nobody deals them as a normal person. But if you go and talk to them, if you give them your time, they at least feel valued that I am being considered. So that is one of the things that you would all do is go and visit and talk to them and find out how they are, how do they do. Because we marginalize them. And once we marginalize them, they have a marginalized existence. I also work with Alaknanda ma'am, again in a very voluntary way, because she works with prisoners. And it is the same issue, they are marginalized. So if you marginalize them, how do you bring back, how do you give them the respect that they can also behave like us and be civilized like us?
My question is, you're talking about people who've come out into the open, or rather we have found them. But in all of our families, unfortunately there are people like this who are also marginalized, who have this kind of mental health problems which are hidden away. They are hidden away. We do not want to accept, acknowledge, because somewhere, as you said, it also kind of reflects back on us. It shouldn't, but then the fact remains that a lot of our people do think like that. So therefore, we want to treat them. I'm speaking from experience because I have an aunt, for instance, and we all do have people in our families. So if she behaves differently, then she's laughed at, ridiculed, behind her back. But it does happen. We don't have that empathy, and that's a stark reality of our lives. How do you feel about people like that, who really are people who are marginalized in a completely different way, who are hidden away in a different way, by keeping them within this space, but they are hidden as well?
It has to start with at least one person understanding that there is a problem. If one person in that entire thing is amenable to look at change, then something like family counseling, family therapy, family coaching can start. First it can be just one or two people, and then slowly the rest of the family can be involved. Lastly, the patient comes into the whole thing. But it's a concept. I don't think it has been practiced anywhere yet.
Unfortunately, I don't think it's practiced simply because you don't want to admit it. The first thing I think is admitting.
One person has to.
Yes.
Admit.
In traditional societies, in larger, bigger families, we always had one person who would have some mental imbalance, and if everybody remembers their childhood, they were not laughed at. They were just looked upon as a person who had some oddities. They were accepted with their oddities. It's only that in the modern civilization, when we are singular, that we don't want them in a perfect life, that we want to keep them apart. So it's basically that perfectionism, that ideal consumerist life that we are looking at, those aberrations we want to hide under the carpet. But aberrations have always been there. How as a society we take them and we carry them depends upon how futuristic we are and inclusive we are.
See, most of the specially abled people, society in some way have rejected them. Most of them actually carry a certain amount of self-worth. Second is mental health, stress. How do we bring in coaching? There has to be a certain amount of hand-holding and mentoring also. So how does one work that? That is a question which I'm asking you all. And another community which we need to work on, because now most of the companies are working towards DEI, is the LGBTQA community. How do we empower them? And how do we get the society, give them that confidence?
A few years back, when we did a found out the statistics of suicides, we found that if there was one suicide in Calcutta, I'm talking of children, there were 10 in Jamshedpur. So high level of stress in the sense, I don't know. So like you get into IIM, you want the best IIM. If you want the IIT, I want the best IIT. Because of parents and a smaller place and so much of competition. So that's when, at that time I was in management development and Mr. Shinoy would know that. So we started with a forum which is still runs there called Samarthya. Now Samarthya, what they did was that we, student to student, people will listen. It's like students are like role models. So now so we said let's train the students. So we had people who kind of worked on these students, who volunteered to do this on different emotions, how to deal with love, how to deal with anxiety, stress, anger. So there were number of sessions, and then we had contacts with different schools, and there are a lot of good schools. Jamshedpur is known for schools. So lots and lots of good schools. Even I did not know, though I've been brought up in Jamshedpur. There are so many schools. And then we asked these students, of course we made the contract, and we then interacted with the principal and the teachers and the students to students. We didn't come in between. And a lot of things did kind of show that it had kind of coming down. And then we had workshops and all with the school principals and all that. I'm just seeing this as a kind of a similar kind of a issue. Yeah. This is also a larger issue. How do we tackle this? That was a smaller place. Maybe we tackled in a place in Jamshedpur. But this is kind of a all India issue, or maybe elsewhere also.
I think this forum is primarily to bring those problems or situations where we are yet to touch. So thanks for bringing this up. And I just want to respond to Suniti's question that there is a huge section in the global, there are 60,000 coaches globally, and there are a lot of coaches who are actually DEI specialist coaches. We have coaches who can handle people who cannot hear. So there are some institutions who are actually teaching them sign language. In fact, just the other day, I was talking to one of our coaches who was supposed to come here, Malika from Pune. She had to cancel her trip. Her father-in-law is now old and cannot hear at all, and her wife met with an accident. Both of them were there. She got fired and she was shouting for help, and no one could be there. So there are 40% burn, and she's in the hospital. That's why she couldn't come. The reason is he was not able to hear, and she was telling that. So it's not only people who does not have hearing ability earlier, but it can also happen gradually. I think we all need to learn sign languages, or we need to. There has to be specialist coaches who are doing it. We don't have anything like this in India at all. But I can see, because I'm also in the panel of reviewing coaches for awards and all, I see there are tremendous amount of work which is happening across the globe on these areas. On the LGBTQ also, there are, when we are declaring the awards for coaches, this part is there. Someone who has worked on this. In fact, Today we had a section in our earlier one where we invited people from other, the third gender or whatever, how we call, and we generated some interest. There is something which already is happening there. So the potential of coaching or potential of listening to people, potential of being empathetic, potential of creating a difference in people's life is huge. So I just want to conclude today by something which I really learned from Dr. Ravi Kannan. If you are receiving anything extra, it is to be given. And be it your time, be it your money, be it whatever it is. So I think each one of us have a purpose. That's what we keep working towards, and then we just need to know that, and we have to reach the Chindu. That's what we started our discussion with, how we can change ourselves first, because if we cannot take care of ourselves, we cannot take care of others. And then how we can take care of our team. Team also includes family. I think one of you actually brought that up. Family and people around us, and the organization, and the larger community.